CDC responds to Zika. Zika 101. What is Zika virus disease? Zika. Disease spread primarily through the bite of an infected Aedes aegypti or Aedes albopictus mosquito. Many people infected with Zika virus won't have symptoms or will only have mild symptoms. However, Zika in pregnancy can cause birth defects. Where has Zika virus been found? Before 2015, Zika outbreaks occurred in Africa, Southeast Asia, and the Pacific Islands. Currently, outbreaks are occurring in many countries and territories. How is Zika transmitted? Zika can be spread through mosquito bites, from a pregnant woman to her fetus, sex with an infected man, possibly blood transfusion, organ and tissue transplant, fertility treatment, and breastfeeding. What are the symptoms? The most common symptoms of Zika are fever, rash, joint pain, conjunctivitis, red eyes. Other symptoms include muscle pain, headache. How does Zika virus affect people? Anyone who lives in or travels to an area with Zika and has not already been infected with Zika virus can get it. Many people with Zika will not have symptoms or will only have mild symptoms. Symptoms last several days to a week. Severe disease requiring hospitalization is uncommon. How does Zika affect pregnancies? Zika virus can pass from a pregnant woman to her fetus during pregnancy or around the time of birth. Not known how often this happens. Zika infection in pregnancy can cause microcephaly and other severe fetal brain defects. Microcephaly, birth defect in which a baby's head is smaller than expected when compared to babies of the same sex and age. No evidence that previous infection will affect future pregnancies. How does Zika affect infants? Other problems have been detected in fetuses and infants infected with Zika virus before birth. Miscarriage, stillbirth, absent or poorly developed brain structures, eye defects, hearing deficits, and impaired growth. No reports of infants getting Zika through breastfeeding. Zika Pregnancy Registry. CDC established the U.S. Zika Pregnancy Registry to collect information and learn more about U.S. pregnant women with Zika and their infants. Data will be used to update recommendations for clinical care, plan for services for pregnant women and families affected by Zika, improve prevention of Zika infection during pregnancy. Zika Active Pregnancy Surveillance System is used in Puerto Rico. Does Zika cause Guillain-Barré syndrome, GBS? GBS is very likely triggered by Zika in a small proportion of infections, much as it is after a variety of other infections. GBS is an uncommon sickness of the nervous system in which a person's own immune system damages the nerve cells, causing muscle weakness and sometimes paralysis. The Brazil Ministry of Health is reporting an increased number of people affected with GBS. CDC is investigating the link between Zika and GBS. How is Zika diagnosed? Diagnosis of Zika is based on a person's recent travel history, symptoms, and test results. A blood or urine test can confirm a Zika infection. Symptoms of Zika are similar to other illnesses spread through mosquito bites, like dengue or chikungunya. Your doctor or other healthcare provider may order tests to look for several types of infections. How is Zika treated? There is no specific medicine or vaccine for Zika virus. Treat the symptoms. Rest. Drink fluids to prevent dehydration. Take acetaminophen, Tylenol to reduce fever and pain. Do not take aspirin or other non-steroidal anti-inflammatory drugs, NSAIDs. What to do after getting Zika? Protect yourself from mosquito bites. During the first week of illness, Zika virus can be found in blood. The virus can be passed from an infected person to a mosquito through bites. An infected mosquito can spread the virus to other people. Preventing mosquito bites. Zika is primarily spread through mosquito bites. Protect yourself. Step 1. Keep mosquitoes outside. Here's what you can do to control mosquitoes outside your home. Use an outdoor insect spray made to kill mosquitoes in areas where they rest. If you have a septic tank, repair cracks or gaps. Once a week, empty and scrub, turn over, cover, or throw out items that hold water. Tightly cover water storage containers. Use larvicides to kill young mosquitoes in large containers of water that will not be used for drinking. Here's what you can do to control mosquitoes inside your home. Use windows and door screens. Use air conditioning when possible. Once a week, empty, scrub, turn over, or throw out items that hold water. Use an indoor insect fogger or indoor insect spray. When using insecticides, always follow label directions. When traveling, stay in places with air conditioning and with window and door screens. Use a bed net if air-conditioned or screened rooms are not available or if sleeping outdoors. Step 2. Create a barrier between you and mosquitoes. Cover up. Wear long-sleeve shirts and long pants. Treat clothing and gear. Use permethrin to treat clothing and gear or buy pre-treated items. See product information to learn how long the protection will last. Do not use permethrin products directly on skin. Step 3. Wear insect repellent. Use Environmental Protection Agency (EPA) registered insect repellents. Use a repellent with DEET, picaridin, IR 535, or oil of lemon eucalyptus or paramethanediol. Always follow the product label instructions. Do not spray repellent on the skin under clothing. If also using sunscreen, apply sunscreen before applying insect repellent. Step 4. Protect your family. For babies and children, do not use insect repellents on babies younger than 2 months old. Do not use products containing oil of lemon eucalyptus or paramethanediol on children younger than 3 years old. For babies and children, cover crib, stroller, and baby carrier with mosquito netting. For babies and children, do not apply onto hands, eyes, mouth, and cut or irritated skin. Adults, spray onto your hands and then apply to a child's face. Step 5. Protect your partner. A man with Zika virus can pass it to his sex partners. In the known cases of sexual transmission, men had symptoms. Zika can be passed before his symptoms start, while he has symptoms, and after his symptoms end. Men without symptoms may be able to pass it to their sex partners. Zika virus can stay in semen longer than in blood. We do not know if a woman can pass Zika to her sex partners. If sexually transmitted Zika virus poses a different risk of birth defects than mosquito-borne transmission. Not having sex can eliminate the risk of getting Zika from sex. Condoms can reduce the chance of getting Zika from sex. Men who live in or travel to an area with Zika. If you have a pregnant partner, use a condom correctly every time you have vaginal, anal, or oral, mouth-to-penis sex. Or, do not have sex during the pregnancy. Men without a pregnant partner who recently traveled to or lived in an area with Zika. If you've been diagnosed with Zika or have or had symptoms, you can use condoms or not have sex for 6 months after symptoms begin. If you never develop symptoms, you can use condoms or not have sex for 8 weeks after returning from travel, or while there is Zika in the area. Step 6. Do your homework before traveling. If you are pregnant, do not travel to areas with Zika. If you must travel, talk to your doctor or other healthcare provider before your trip. If you are trying to get pregnant, talk to your doctor or other healthcare provider before you travel. if you choose to travel. Strictly follow steps to prevent mosquito bites to protect yourself and your family. Even if you do not feel sick, travelers coming to the United States from an area with Zika should take steps to prevent mosquito bites for 3 weeks so they do not spread Zika to uninfected mosquitoes. See the latest travel notices at www.ncdc.gov/travel/page/Zika-travel-information. What is CDC doing? Activated Emergency Operations Center, EOC, to Level 1. Providing on-the-ground support in affected areas. Educating healthcare providers and the public about Zika. Posting travel notices and other travel-related guidance. Providing laboratories with diagnostic tests. Creating and distributing Zika prevention kits to affected U.S. territories. Conducting a study to evaluate the persistence of Zika virus in semen and urine among male residents of the United States. Working with partners to monitor and report cases. Conduct studies to learn more about the potential link between Zika and Guillain-Barré syndrome. Create action plans for state and local health officials to improve Zika preparedness. Publish and disseminate guidelines to inform testing and treatment of people with suspected or confirmed Zika. Publish and disseminate conclusions on the causal association between Zika and microcephaly. For more information, contact CDC. 1-800-CDC-INFO. 1-800-232-4636. Text telephone 1-888-232-6348. www.cdc.gov. The findings and conclusions in this report are those of the authors and do not necessarily represent the official position of the Centers for Disease Control and Prevention. Even if your area has no Zika scare, it is important to ensure that you drain any stagnant water. That usually fuels the reproduction of mosquitoes. Even better, you can opt for professional mosquito control in your backyard. This will not only give you fewer reasons to worry about Zika, you will also enjoy your evening tea outside without having to swat away mosquitoes. Mosquito Guy has your back on this. Give us a call, 301-747-5377, or email us at info@mosquitoguy.net, and one of our friendly guys can give you a free quote. You can also visit us on the web, www.mosquitoguy.net, for more info.